Welcome back, everyone, and thanks again for being with us. Now, when we think about staying healthy, we should not skip over our mouths. In fact, today is World Oral Health Day, giving us a chance to consider what we can do to avoid getting mouth diseases.
It's especially important because research is finding a link between bacteria in the mouth and the development of other diseases that can destroy parts of our nervous system, like Alzheimer's. So joining us this afternoon to talk more about that connection as well as important prevention is Dr. Dhruve Jeevan. He's a neurosurgeon at St. David's Round Rock Medical Center. Thank you so much for being here with us today.
Thank you for having me.
So it may be a little bit confusing for people if they're thinking, how is my mouth connected to all the other parts of my body? Explain how bacteria in our mouths can really contribute to some of those other health problems.
Sure. So the oral microbiome is like the second largest bacterial microenvironment in your body, right? It's also the main entry point into your body for most things. So it's not unreasonable to suggest that this environment has a huge impact on systemic disease. Gum disease has been linked to heart abnormalities. Poor dental hygiene can lead you to get infections, which can affect your bloodstream and your heart. And it's not a far-fetched to then say that these environments can then affect other organs or disorders, including your brain.
Yeah, you are leading right into our next question. So we want to know, there is research out there showing that link between gum diseases and even neurological disorders in particular. Can you talk about what are some of those examples and how that can happen?
Sure. So poor gum disease is led to spread of bacteria into the bloodstream. That can lead to an immune response from your body which tries to fight off that response. Part of that immune response can be overwhelming, especially in the brain, leading to plaque development in the brain, which can be linked to Alzheimer's and Parkinson's disease. That's the theory behind it. There's still some research that's needed to pinpoint the exact link, but that's what this data is pointing to.
We want to talk about Alzheimer's for a second here. Texas Health and Human Services reported just last year that Texas ranks 4th in the nation for Alzheimer's cases and then 2nd in the number of deaths connected to the disease. And so that prevalence really may make people at home wonder, what can I be doing to protect my brain health, especially when it comes to this new research about oral hygiene? So what are some ways that people can maybe make small changes at home to maybe prevent something down the line?
So regular checkups with your dentist and having good oral health is vital, but also patients who may be already starting to develop signs of Alzheimer's. One of the big things that this study pointed out was that these patients forget about their oral hygiene as part of their Alzheimer's process, and just having that secondary care and having someone check in and making sure that they are maintaining appointments and good oral hygiene at home may also be beneficial.
Yeah, hopefully that'll be helpful for people out there too. I want to wrap up because there are so many different advancements related to these kinds of care. Are there any things that you want people to know more about, just off the top of your head?
In terms of Alzheimer's and neurodegenerative disorders, there's a lot of focus from both the government and research in trying to prevent it or help reverse these processes, from vagal nerve stimulators to focused ultrasound and new medications that's coming out too. It's kind of a hot topic in trying to prevent and reverse some of these neurodegenerative disorders.
We know it's something we're seeing at the statewide level with a center that's up for discussion at the state capitol too. So lots to watch in your field of study. So Dr. Jeevan, thank you so much for being here and exploring this topic with us today.
No problem. Thank you for having me.